Well, I mean, obviously, first and foremost, it's like tragic, but the fact that he's been wheeled off the pitch on oxygen means that there's a real chance that he's made a recovery, and the staff and people who've attended to him immediately have made a phenomenal difference in his outcome. And I think that's what people should take away from this, is that if you can get rapid medical assistance, defibrillation, everyone learn cardiopulmonary resuscitation, that you can save lives. I think it's going to create an enormous amount of awareness in the public that everyone must learn how to do CPR. Everyone must learn how to refer to medical services. Everyone must know where the nearest defib is. We're just lucky that the players on the pitch knew what to do to put him in a safe position, make sure he wasn't choking, and alert the medical team. It's clear from straight away that there's a problem. If a player collapses on the pitch, then there's a serious issue, because people collapse day in, day out, but often they collapse because their blood pressure and their pulse has dropped. But when you're running on a pitch with a high heart rate and a high blood pressure, you shouldn't collapse. So as soon as someone collapses on a pitch, it's a serious issue. Well, I mean, if he's unresponsive, for which it was clear, you know, the ball hit his leg, he was gone immediately as he hit the ground. You know, it's basically assessment. It's airway, breathing, circulation. So you're checking if the person's breathing. You're checking if the person has a competent airway, and if they have any pulse. And if they don't have that, you have to start, you know, cardiopulmonary resuscitation, which is what is seen on the pitch. The medics are doing that whilst the players are surrounding their colleague. And everyone should learn what to do. It's not difficult. I mean, you basically need to learn where to put your fingers on the chest, and then you need to do 30 compressions a minute, almost like to the tune of Baby Shark. Everyone knows the song Baby Shark, but you basically pump the chest as if you're going to the rhythm of Baby Shark. You know, it's 30 compressions, and then if someone can give breaths, you give breaths, but you want to make sure you're pumping that heart as often as you can. It's actually 100 beats per minute. Sorry, I said 30 there, but you want to get chest compressions ASAP, and it doesn't matter about the breaths, really. It matters about pumping the heart and circulating the blood. Well, having just dealt with a patient who's had this as a 22-year-old footballer locally, he needs extensive cardiac investigation into why this has happened. And often the start is in a basic ECG, so a basic 12-lead electrocardiogram, so the measurement of the electrical activity in the heart to see what is going on. And that can give various indicators as to why this may have happened. Now, Eriksen has had many transfers, and actually is in an Italian club at the moment, if I'm not mistaken. And the Italians are the best at screening for heart disease in competitive athletes. So he will require an ECG. He will require a heart echocardiogram to see what's happening to his heart muscle, and he'll probably need a cardiac MRI scan, so a detailed scan of his heart muscle to see whether there's any scarring, to look at his right ventricle to see how it's performing. But he will need extensive investigation, and probably a special pacemaker called a defibrillator, which monitors every heartbeat and is able to tell whether the heart is about to do this again. And then if it does do it, the defibrillator can activate and can shock the heart internally. So we've seen this before with, you know, highlighted cases such as Fabrice Muamba and people who are less fortunate. A chap from my own hometown called Phil O'Donnell, who died on the pitch. And this is happening week in, week out. And what people need to realize is that this is an awakening for people. This happens week in, week out to players, not just elite players who are celebrities or playing at national level. This happens at grassroots level. This happens on Sunday league pitches. And the more we realize that, the more we can enable people to be able to deal with that if it happens and save lives. I think it probably is for him. I mean, the Italians often stop people. It's in law. They stop people from participating in sport if they're found to have a significant cardiac abnormality. And they've been doing that for a long time, you know, beyond 20 years. And they've reduced some of the death rates from sudden cardiac death in sport from, you know, up to beyond 3% down to below 1%. So it is a rare event, an exquisitely rare event. And even if you do screen, he comes from an Italian club, so he must have had all of the tests before he started. Even if you do screen, it can still happen. That's the problem. You can hopefully screen out the people who've got serious ECG abnormalities or serious echo abnormalities or serious MRI abnormalities, but it still happens to people who've got subtle things that we call channelopathies. So the channels in their heart that flux the electrolytes and the salts and various things that cause the heart to be able to pump and the electrical activity in the heart. Occasionally you've just got a genetic defect of that is almost quiet or hidden, and it's only unmasked once in a lifetime, but it's enough to kill you. This is actually happening not just to Eriksen, it's happening throughout the world. And by showing those images, if that creates, you know, even 1 or 5% awareness within the general population of the world that this sudden cardiac deaths happen, then in a way it has probably helped future people, because maybe someone will take up CPR, maybe someone will go into nursing or cardiology or being a doctor at pitch side or, you know, sports medicine, those sort of specialties because of this. I think for the general viewer, then I think, you know, it's not something you want to watch, is it? You know, someone being defibrillated or someone having CPR. So I think there should have been some sort of, you know, screening or some sort of suggestion that there's a serious incident on the pitch, and not zooming in and not, you know, making a focus of this. But in the same way, you know, I think there's always two sides to every story. So if this creates awareness, and I'm sure Eriksen himself will turn around and say that, you know, the same as Fabrice Muamba has done, that, you know, we need more attention, more funding, more participation in screening of athletes and of the availability of CPR and defibrillation in places where sport happens. This chap's moved from multiple clubs. He's had multiple medicals. He's in Italy, which is the greatest cardiac pre-participation screening in the world, showing evidence that they reduce events, but he still has an event on the pitch. So it is a very difficult thing to try and eliminate. You are still going to have that 0.01% of people who will still have something happen. I mean, I've recently dealt with a 22-year-old where I live in the Wirral who had a similar event, collapsed playing football, and he now has a defibrillator in place, and he has, you know, survived the event. But this is happening to young kids everywhere, not just professional footballers.